Hello everyone, my name is Alexandru C. I'm enrolled in the PTA program at San Antonio Concord Career College, and today I'll be talking about the anterior cruciate ligaments, or abbreviated the ACL. This is Anaida, she's my fiancée. She's going to help me today with this video. Um, there are four major ligaments in the knee. We have the anterior cruciate ligament, the ACL. This ligament is located in the center of the knee that controls the rotation and forward movement of the tibia or the shin bone. Then we have the posterior cruciate ligament, the PCL. This ligament is located also in the center of the knee and controls the backward movement of the tibia. Then we have the medial collateral ligament, the MCL, the ligament that gives the stability to the inner knee. And then the lateral collateral ligament, the LCL, the ligament that gives the stability to the outer knee. Those four major ligaments in the knee connect the femur, the thigh bone, to the tibia, the shin bone, the biggest bone in the lower leg. Injuries to ACL can occur in a number of situations, including sports like mine happen, playing soccer, and can be quite serious, requiring surgery. The ACL runs diagonally deep inside the knee from the center of the rotation of the end of the femur, the thigh bone, to the top of the tibia, the larger bone, like I said, in the lower leg. The injury can happen when your foot is firmly planted on the ground and a sudden force hits your knee while your leg is straight or is slightly bent. This can happen when you're changing directions rapidly, slowing down when running, or landing from a jump. For example, when men jump, they land on both legs with their knees bent, while women tend to land with their knees in a straighter position, putting more stress on the knee joint.
Okay, Alex, so how is an ACL injury diagnosed?
Well, an ACL tear can be diagnosed by a physician through a history of physical examination. On physical examination, the physician can specifically assess the amount of motion present and determine the ACL is torn. They can also prescribe for you to have X-rays, and they are taken to evaluate for the presence of any fractures. In many patients, an MRI scan of the knee may be ordered, or also the scan can clarify the question of an ACL tear if the history and the examination are inconclusive.
Okay, what about the different types of ACL injuries or tears?
Well, they're classified in three grades: 1, 2, or 3. The grade 1, the grade 1 injuries include ACL that have suffered mild damage. For example, if when the ACL is mildly stretched, but it still provides adequate stability to the knee, that's a grade 1 ACL injury. The grade 2 are usually rare and describe an ACL that is stretched and partially torn. And there we have the grade 3, when the ACL tears happen when the ACL is torn completely and is no longer providing stability to the knee joint. Usually the initial treatment includes ice and anti-inflammatory drugs. The next phase is usually stretching, exercise, and physical therapy to rebuild strength and regain the motion. The ACL does not heal on its own, but the surrounding knee of the knee muscles can be built up through exercise and physical therapy, a process that can take up to a year. And then we have when the ACL injury is more severe, and they are complete tears, especially in younger patients, may be surgically repaired. The surgery usually done by arthroscopy. Arthroscopy means that they make two small incisions in your knee. One they will go up to one incision with a camera to see what's going on in your knee and what needs to be removed and repaired, and with the other one goes with a scope that cleans up everything, the damage made inside your knee. And sometimes, most of the times, is replaced the ACL with the cadaver parts or the patient's hamstrings or the patella tendons. In this case, when there are severe ACL injuries, the rehab takes at least 6 months. The first key to ACL rehab is simple. Is to diminish the pain and the inflammation associated with the surgery. Pain and swelling has been shown in numerous studies to essentially shut down your muscle around your knee, specifically your quads. So as simple as this concept may be, diminishing pain and inflammation should be an area of focus initially after the surgery. We can do it with compression wraps, ice, intermittent compressions machines, elevation, ankle pumps, electrical stimulation, and not pushing through too much activity can also help too. Another thing about when you have an ACL a surgery and they repair and they replace it with a cadaver part, it's very important that restoring the knee extension immediately, because once it gets tight, it's often hard to get your motion back. I'd much rather focus on the initially and slowly restore motion that get too tight and then have to aggressively attempt to improve motion. That's never preferred. When you have loss of full knee extension, that doesn't allow the knee to function properly, even if it's just a small loss of motion. Plus, the studies have shown loss of motion to be one of the most important factors associated with development of arthritis after an ACL surgery.
And all of those being said, my question is, will I be needing crutches?
Most of the doctors encourage the patients to not use the crutches, to put full weight bearing immediately post-op, unless instructed otherwise, of course. This means that you may put full weight on the leg, with the leg, of course, with the leg brace locked in full extension. The doctors prefer us to put weight on the leg to maintain strength and encourage healing to occur. But like I said, most of the doctors, sometimes if it's a severe injury, they usually ask you to use crutches until you feel that you got your strength back in order to not make any more damage to that knee. I remember when even after the first and the second surgery, they transported me out of their hospital on a wheelchair. That was their policy, but then again, in other hospitals it might be different.
What what about the brace? How long should I be wearing that?
Everybody's asking how long should they wear the brace. The brace is used to give you support that you don't support, so you don't need crutches. Initially, you lack of strength to stand, and so the braces kind of enables you to stand and walk. For the first 3 weeks, you will need to keep the brace the brace locked while walking. You may remove the brace when you're in bed, when you're relaxing. You might want to let the knee breathe per se. But after 3 weeks post-op, you should unlock the brace and walk. This will give you stability as you begin to walk and get to bending the knee. This will also build up some more strength before you remove the brace completely. After 4 weeks of hard working and doing your exercises and working with a physical therapist or a physical therapist assistant, it's recommended, again, if you feel like you got your strength back, you can take the brace. You may wean yourself from the brace altogether. You may begin not wearing it at home or in control setting. That might help you a lot. And then gradually lessen its use over the next few days to a week. That being said, I want to show you guys a few exercises that you can do at home or in a clinic for the first and the second week post-op. There's simple exercises to get your strength back and the range of motion, and that probably will help you and with the bending your knee. So this is the brace. Easy to put on, it's easy to lock it, it's easy to remove it. That shouldn't be a problem. If you go back just a little bit more, usually you put it over there is an opening in the middle of it, so you have the patella there. You just wrap it around your knee nice and tightly. You might not really tight. You want your leg to breathe and for the blood circulation. You guys, that being said, I want to show you a few exercises you can actually do in the first week post-op. Like I said, Zenaida is going to help me to show you how to perform those exercises. One of the first exercises that you can do and your PT or PTA will provide you to do at home is to do knee bends. That means with your legs strengthened, you will try to bend your knee up slowly. Maybe you want to put a towel underneath your heel, so this way you can grab the towel and pull the towel so you can bend it more easily if you have pain. But then again, it's not recommended to do it when you have pain. You bend it as much as you can to the point where you feel discomfort. It's never recommended to exercise and perform exercises when you have pain. So that's one of the exercises you might up and down. Let me show you one more time. It's up and down as much as you can, and then back and relax for a second, and then up again. You perform this exercise 3 sets of 10 reps. Then another exercise that's really good for strengthening your quads and your legs and your knee is you lay down all the way down. You raise and you bend your the knee, the leg that didn't have surgery, and then you're gonna perform leg raises. But when you raise your leg, you wanna bring it equal to the other knee, and you're gonna do the same thing, 3 sets of 10 reps each. Another good exercise for this kind of injury, you just lean and lay on the side, and the same thing, you lift your leg up and you raise it up and down and relax for a second, and then one more time, and so on, and you're going to do again 3 sets of 10 reps each. Like I said before, restoring that the motion. You don't want your knee to get too tight, especially if it's from a cadaver. So this is going to work on your extension. What you want to do is just either a towel rolled up or a pillow. I'm going to use a pillow in this video. You want to just put it under your heel, and you just relax your your knee. This way, will the knee will strengthen. This way, you'll get your full extension back, and this way you strengthen your knee also. You want to do this again, 3 sets of let's say not 10 reps. Let's say every 3 sets of 10-15 seconds. You relax your leg, and you might want to do this exercise. This is for the first week, and you might want to do these exercises at least 3 to 4 days. You want to do it in the morning, maybe mid-afternoon, and then later on before supper, and then after supper you can also perform those exercises, and it's also recommended after every exercise, after every cycle of exercises. You might want to put your leg, raise your leg up, and put some ice, get that swelling back in order. So now I'm gonna show you how to properly use crutches. Before that, you never want to lean forward on those crutches. You want them right in your rib cage, within your apparatus. Now it's very important when, let's say, the right leg is injured, right? The crutches in your right leg should be best friends. Wherever that leg goes, those crutches go. So what this means is, and again, you should be careful and not make big steps, so you can lose your balance. So small step would be great. Okay, so there you go. That's the right way to do it.